Welcome to another edition of Motivational Monday. My name is Annette. I'm a registered dietitian here, and I wanted to talk to you today about celiac disease and a gluten-free diet. You may know somebody who has been diagnosed with celiac disease. We're hearing about it more and more. In fact, we know that the incidence of diagnosis is increasing every year. What concerns us is that there are many people who are walking around with the disease and have yet to be diagnosed. The classic symptoms include, but are not limited to, GI pain, whether it's gastrointestinal diarrhea or constipation, gas, bloating, fatigue, brain fog, nausea, vomiting, skin conditions, just to name a few of the symptoms. So as you can see, many of the symptoms overlap with many other chronic diseases. So diagnosing celiac simply by symptoms can be rather tricky. There is an easier way to do it besides the gold standard of the small intestinal biopsy, and that includes a blood test. So we are able to do that here at Thrive to determine whether you have the genetic susceptibility of the genes, as well as any antibodies which would indicate that you do have celiac disease. So in order for celiac disease to initiate, there must be a marriage between the genetic susceptibility, the environmental trigger, as well as through the gateway of intestinal permeability. So all those things begin this autoimmune illness and would leave someone with a diagnosis. It's important to note that when you follow a gluten-free diet, because that is the only treatment for celiac disease, that many of the foods that are labeled gluten-free are not necessarily healthful. These foods may be devoid of many important things, nutrients and fiber. So realize that just because a food says gluten-free, it is not healthful. Here at Thrive, we work together as a team to make sure that someone with such a diagnosis is given a very personalized nutrition plan that is full of nutrients, nutrient dense, as well as blood work to determine any levels of malabsorption that may have occurred. So the gluten-free foods can be highly processed, and they can be devoid of nutrients, as I mentioned, and also be very high in calories, sodium, sugar, and fat. So we don't want to rely on these foods. Rather, we would like our patients to choose from whole grains that would include buckwheat, amaranth, quinoa, garbanzo bean flour, and wild rice, just to name a few of the higher fiber choices that are available out there. Cross-contamination is a concern if you've been diagnosed with celiac disease, because even a small amount of exposure to gluten can continue to damage the small intestine. So patients need to be educated on label reading, grocery shopping, planning an appropriate menu, creating a gluten-free kitchen to avoid cross-contamination, as well as how to eat in a restaurant. There are many places that gluten can hide. Some things that you wouldn't necessarily think of, like bouillon cubes, imitation crab meat, medications, candy, just to name a few. So in addition to receiving a diagnosis, as well as the education, a thorough physical should be conducted along with lab work to determine the level of malabsorption, if any exists. Thereafter, a yearly physical with your doctor to continue to assess that, as well as meeting with your dietitian to make sure that there is not any inadvertent exposure to gluten, which may show up in terms of malabsorption or antibodies. Studies show that those who do follow a strict gluten-free lifestyle can have vast improvements in their health, as well as decrease completely in symptoms. What's really important when you're following a gluten-free diet is that you are building a healthy gut microbiome. We pay a particular attention to prebiotics, probiotics, fiber, as well as vitamins such as B6, B12, folate, vitamin D, minerals like calcium, magnesium, copper, zinc, and iron. Early detection, as well as follow-up, is important to treating this chronic disease and avoiding any exposure to gluten. Though no one wants to be diagnosed with an autoimmune illness, the treatment is very successful in preventing long-term consequences. It will require education along with a strong relationship with your physician and dietitian. We're here to support you back on your journey to health. Thank you.